Hey, it's Angie with Angie's Beyond the Lecture. So I have a comment that came in this morning about the AHIMA RAC exam. So I wanted to address that real quick, and doing this also since it's the new year. I haven't really talked about my AHIMA uh, RAC experience lately, or my preparation for the CCS exam. So I'll read the question real quick. And this person is simply saying, hey, I have 20 plus years experience in coding and but have never done risk adjustment. Do you think that just the study guide would be enough? And then they go on to say they have the COC through AAPC, and do you find out right away if you pass? So the good news is on the AHIMA risk adjustment coding micro credential, yes, you do find out right away. I recall at the end of the exam, once I took my you went through the 65 questions, you hit submit, and it thinks for a little bit, and then it pops up and says your score. And of course, you're looking for 70 and above. I had 80 plus. I want to say I was in the 81, 82 range, which is darn good enough to get that micro certification. And going back to the question here, the first question, what comes to mind is simply your competence in test taking, right? So you clearly have the chops to you test well in the bulk of the questions. So give me a moment. I'm going to go back to my blog here because I actually did. I After I took the exam, I wrote down what stuck out to me simply to be helpful, and with the caveat that, of course, all exams are not the same. I'm sure they have an enormous bank of questions and that that they pull from. So what I got might not be what you will get, but I'm sure you'll see some common themes there. And that was the point of me putting that blog out and just discussing that freely on YouTube. So, as being a previous coder, right, of having longstanding coding experience, I think that would definitely, as far as my bullet points on, and I'll link my blog here below because I put this out actually on July 13th. And the two bullet points I think that would stand out that this person would probably excel or really do well in is we have the challenging and scenario based detailed chart reviews, right? So that could be any setting, ER, inpatient, and outpatient. So if you're doing outpatient, maybe inpatient might be more of a challenge for you. And also we have the chronic conditions from the ICD-10 CM. So you'll notice, and there's a list. I don't remember the domain. It was 5 or 6. I know there's a half a dozen domains, and it's the last one listed in that PDF file on AHIMA for the RAC exam. But it outlines, all these chronic issues that could be risk adjusted, right? And I listed, I see about, I'm guessing about 15 at least, maybe 15 to 20, including COPD, rheumatoid arthritis, Sjogren's, hemiplegia, all the way down to coronary artery disease, diabetes mellitus, right? Those common chronic diseases, right? So you definitely want to go through those chapters. Chapter 10, I think no, sorry, chapter 4. Chapter 4, endocrine, and the following chapter, or I'm sorry, not the following chapter, respiratory. I mean, I think those are pretty big. The nervous system, right? You definitely need to have a solid understanding of the ICD-10, CM coding, and the rules, and the code, the coding sequencing or order, right? And the other topics there, so I have like maybe 8 or 9, I guess. Probably about 10. 10 bullet points there. Those are going to be ones that stuck out, like I saw more than once, right? And that would include the MEAT, monitor, evaluate, assess, and treat. Quality programs, a lot of questions on that, and especially as it relates to Medicaid, because that's the big player and payer in the claim space, medical claim space, medical terminology, and then just knowing, like, I remember questions like, what, if I have this particular condition, it's indicative of this diagnosis, things like that. But really the prevailing theme is here, you got to be able to pick out or extract your diagnosis codes and be able to read through charts. That was at least a dozen questions on that exam. And those are the hard, like you're reading through multiple pages, you're scrolling down and going through the whole scenario from top to bottom on this provider's chart, and being able to read through that and understand what ICD-10 codes you need to pick out appropriately for that. So I hope that is helpful. And this is coming from someone, I don't have active coding experience. So my background and probably saving grace is I have a biology degree. I have a master's in healthcare administration. I've been a long time STEM tutor. So, and that includes like for chemistry and anatomy and physiology. And so, I think that helped me, just having confidence in test taking. I think that's a big thing. You have 3 hours, and it's technically it's non-monitored, right? So you you have a solid amount of time to get it done, but you can't be messing around on your computer. You can't, you can't. Your browsers or your system's kind of on lockdown, right? So any notes, of course you have your coding books, and then any notes to support some of the terminology, right, when it comes to, again, the MEAT, the meet criteria, MIPS, MSSP, and STAR, and then your provider types, and those there's a couple pages. I mean, who's supposed to memorize that? I think the idea is that you need to be able to go out to your resources, have them handy, and say, yes, this particular provider out of this selection and multiple choice is the correct one that can send in risk adjustment codes or be part of that system. So um, again, I hope that's helpful. Glad to be back. Happy New Year. Thank you for your question. And I'm at like 7 minutes, so I better stop yammering and getting on to the day. And of course, studying. I'm actually reviewing for my CCS exam here in early 2026. So 2025 um, was sort of a year of planning and studying and reviewing and everything. I've had coder adjacent roles. I've been in patient access. I've been in physician licensing, which are, they're not directly coding and extracting from medical charts, but the work is largely the same. It's very exacting and very, very detail oriented. And I left my position, my last full-time work, I call it W-2 position, in January. And I've been, reviewing. I took the RAC exam in July, sort of to put my foot in the door, perhaps if risk adjustment is available. It's heavy in ICD-10. That would help me prepare for CCS and roles further on down the line. I'm more of a data analytics person. I hope to get some front end claims experience and then work my way um, through, up to maybe more data analytics or management roles. So that's my personal goal, and where I see myself in the future. And again, appreciate the question. And I'll probably post it or maybe try and capture it and put it somewhere on the screen or in the description. And I hope you have a wonderful day. Thanks for the question. And good luck with your studies and pursuing additional certifications. Bye.